So, let me get this straight. Your adorable little fluffball, the same creature that judges you from across the room and knocks objects off shelves purely for entertainment, that innocent face, that soft purr, that cat can come home with literal blood-sucking parasites attached to their body. Yeah. Welcome to cat ownership. You are probably thinking, ticks on my cat? No way. My cat is an indoor angel. Sure. Until that one time the door stays open for 3 seconds too long and your cat returns looking like they just survived a wilderness survival show called Backyard Apocalypse. Today we are talking about ticks on cats. Not in a boring clinical way, but in a way that actually matters. Because ticks are not just gross. They are not just creepy. They are a genuine health risk that most cat owners underestimate until it is too late. By the end of this video, you will know exactly how cats pick up ticks, where these parasites hide, what kind of damage they can cause, how to remove them safely, and how to stop them from turning your cat into a walking blood donation center. Let's start with how this nightmare even begins. Ticks do not fall from trees. They do not parachute down like tiny parasite skydivers. That myth needs to die immediately. Ticks are ambush predators, lazy ones. They do not chase. They wait. They sit in tall grass, bushes, shrubs, gardens, forest edges, and overgrown yards. Anywhere your cat thinks looks fun. They climb up blades of grass or low plants, stretch out their legs, and just wait. Sometimes for hours, sometimes for days. And when your cat walks by, even for a second, the tick grabs on. No effort, no warning. Just a free ride straight to warm skin and a steady blood supply. This is why cats do not need to go hiking or camping to get ticks. A backyard, a park, a small patch of grass near your house is enough. Ticks are most active in spring and summer, which just happens to be when cats are most eager to explore. So, no, your cat does not need to be adventurous. They just need to exist outdoors briefly. Once a tick is on your cat, things get sneakier, because they do not attach themselves in obvious places. They are not interested in convenience. They are interested in survival. Ticks choose warm, hidden, hard-to-reach areas where they can feed without being disturbed. The head is prime real estate. In the ears, behind the ears, under the chin, on top of the head. These areas are warm, full of blood vessels, and difficult for cats to scratch or clean. Then there are the armpits. Yes, cats have armpits, and ticks love them. Warm, protected, rarely checked, and finally, between the toes. This sounds ridiculous until you find one there. Ticks will wedge themselves between toe pads because they know almost nobody checks paws closely. This is why a quick glance over your cat's back is not enough. Most ticks are hiding where people do not look. If you are not checking the head, ears, legs, and paws, you are missing the places that matter most. Now here is where things stop being just gross and start being serious. Ticks are not harmless. They are disease carriers. They feed by attaching to your cat and slowly drinking blood over hours or days. During that time, they can transmit bacteria and infections directly into the bloodstream. One of the most well-known is Lyme disease. While it is less common in cats than in dogs or humans, it can happen. When it does, symptoms can include fever, lethargy, loss of appetite, joint pain, and general weakness. Your cat may suddenly seem tired, uncomfortable, or just not like themselves. Ticks can also cause localized infections at the bite site. Redness, swelling, itching, and pain are all warning signs. That tiny wound can become a gateway for bacteria. In cases where cats are bitten repeatedly or carry multiple ticks, blood loss becomes a real concern, especially in kittens, senior cats, or cats with existing health problems. Enough blood loss over time can lead to anemia, leaving your cat weak and vulnerable. Here is a crucial detail most people do not know. Many tick-borne diseases are not transmitted immediately. In many cases, the tick needs to be attached for 24 to 48 hours before transmission occurs. That means early detection matters. Finding and removing a tick quickly can be the difference between no problem at all and a serious medical issue. Which brings us to the part where a lot of people accidentally make things worse. Removing a tick seems simple, until it is not. Let's talk about what not to do first. Do not grab it with your fingers. Do not squeeze it. Do not twist it. Do not burn it. Do not cover it in petroleum jelly or oil. These methods are dangerous. When a tick is stressed or crushed, it can regurgitate its stomach contents back into your cat, and that is exactly where the bacteria live. Instead of removing the risk, you increase it. The correct method is simple, but it matters. Use a proper tick removal tool. A tick tweezer, hook, or card designed for this purpose. These tools let you grip the tick close to the skin without squeezing its body. Place the tool as close to your cat's skin as possible, targeting the head. Then pull straight upward with steady, even pressure. No twisting, no jerking, just slow and controlled. Once the tick is out, inspect it. Make sure the head is attached. If part of the tick remains embedded in the skin, do not try to dig it out. That is when you go to the vet. Disinfect the bite area with a pet-safe antiseptic. Then destroy the tick. Do not throw it in the trash. Ticks can survive. Submerge it in alcohol or flush it away, and please do not touch the tick with bare hands. Ticks can transmit diseases to humans too. Now here is the honest truth. Removing ticks is good. Preventing them is better. If your cat goes outside, there is always some risk, but you can drastically reduce it. The first line of defense is routine checks. Every time your cat comes inside, especially during warmer months, do a quick but thorough inspection. Head, ears, legs, armpits, paws, make it a habit. The earlier you find a tick, the safer your cat is. The second layer is preventative treatment. Talk to your veterinarian about options. There are topical treatments, oral medications, and collars designed to repel or kill ticks. Some products kill ticks before they can even bite. Think of it as a security system for your cat's skin. Your cat's environment also matters. Keep grass short. Trim bushes. Remove overgrown areas where ticks thrive. The less cover ticks have, the fewer of them stick around. If you live near forests or wild areas, you may want to reconsider free roaming during peak tick season. Supervised outdoor time, enclosed cat patios, or leash walks can dramatically reduce exposure. Prevention is not overprotective. It is responsible. So let's wrap this up. Ticks are disgusting, sneaky, and dangerous, but they are also preventable. Now you know how cats pick them up, where they hide, why they are a problem, how to remove them safely, and how to stop them from becoming a recurring issue. Start checking your cat regularly. Get proper removal tools. Talk to your vet about prevention. And if you ever find a tick, stay calm. You know what to do. If this video helped you, hit the like button. Subscribe for more practical pet advice that actually keeps your animals safe. And tell me in the comments where you are watching from right now. Stay alert. Check your cats. And remember, ticks are temporary. Your bond with your cat is not.